Hello and welcome to Life is Movement for another exercise tutorial. I make these videos for my own patients here at the clinic. However, if you're not a patient, you're welcome to use it too. Just make sure you do so safely. Now, this is an exercise which we sometimes refer to as the scapular punch, or scapular retraction. Protraction is a more of a technical name, but I offer this exercise to people who either have shoulder, neck, or upper back issues. And it's an exercise to help improve the range of motion of the scapula, the shoulder blades, but also to develop a bit more proprioceptive awareness of the scapula, which can be really, really helpful if you do have neck or shoulder or upper back issues. The scapula move quite a lot, as this exercise demonstrates, but we often don't think about moving the scapula. It happens secondary to something else. So if I want to lift my arm up, about here, my scapula starts to rotate, but I'm not really thinking about it. I'm really just thinking about my arm. So developing proprioception in this area can be really valuable for a variety of reasons. So I'll demonstrate the exercise for you. What we do is bring our arms forward. And what we're going to do is I like to think about moving my hands forward and back. But the trick is you can't bend at the elbow and you can't move at the shoulder. All the movement comes from the shoulder blade, the scapula. So what I'm going to do is move my hands forward, which is protraction of the scapula. And then I'm going to move them back, which is retraction of the scapula. So forward, protraction, and back, retraction. And as you can see by looking at my hands, you can actually explore quite a significant range of motion without bending at any of the other joints, without moving at the elbow or without moving at the shoulder, just by moving at the scapula. Now, when we start to progress, what I start to encourage is for people to also add some neck movement into this exercise. So as you go forward and protract, you might want to bend and flex your neck a little bit. And then as you retract, you might want to just look up to the sky. That little extra element is really useful because, when I think about this whole region, the neck, the shoulders, the upper back, and the scapula, I sometimes think of it as like, it was described to me once by a shoulder expert as like the devices on like a baby mobile. You've got like a mobile hanging over a baby's crib with 4 little toys hanging off it in perfect balance. But if you disturb one of them, they all get disturbed. It's also described as like wheels on a car. If one of them gets uninflated or deflated, it affects all the wheels of the car. And these 4 parts of the body, the neck, the shoulders, the scapula, and the upper back, kind of work like that. They work synergistically. So if you start to have a problem with one, you can often have a problem with all of them. And in an ideal functioning system, they will all be doing a little bit of the work of the upper body. Sometimes a lot of people who have neck problems, what I notice is they have really poor scapular mobility and really, really poor scapular proprioception. They're just not aware of their scapula at all. So by doing exercise for the scapula, what we can do is we can make the scapula a bit more active and start to do a little bit more of the work, which takes the pressure off the other 3 structures, particularly the neck. Give that a go. That is the scapular punch.